Welcome to Have More Babies. Today we're taking a closer look at something lots of parents see, but maybe don't fully understand. Birthmarks. Specifically, hemangiomas. Our mission today is really demystify these common marks. We've got insights from Omega Pediatrics to help us. We want to give you clear, helpful information, about what they are, why they might pop up, and when you might need to seek some expert advice. Okay, let's unpack this.
Yeah, and it's fascinating, isn't it? Because while hemangiomas are really common, affecting maybe 1 in 20 babies, there's often just a lot of anxiety and, frankly, misunderstanding around them. Parents see this red mark, and understandably, their minds can race. So our goal today is really just to provide clarity and maybe some reassurance based on the facts.
I think that's so important because for any parent, especially a new one, the unknown can feel, well, pretty daunting, particularly when it's about your child's health. So let's start right at the beginning. What exactly is a hemangioma? Can you lay out the basics for us?
Sure. So simply put, a hemangioma is a type of birthmark, usually bright red, but it's a bit more specific than just any mark. It's actually an extra growth of tiny blood vessels. Think of it like a little cluster of blood vessel cells that grew more than they were supposed to, right in one spot.
Okay, extra blood vessels.
Exactly. And they typically show up either right at birth or sometimes maybe more often within the first few weeks after birth. It's that dense collection of vessels that gives it that distinct red appearance.
Got it. So it's not just one kind of mark then. I saw the sources mention different categories. Can you walk us through those? I imagine knowing the type helps parents understand what they're seeing.
Absolutely. Knowing the types really helps differentiate what you might observe on your child. It's quite useful. So first, we have what are called superficial hemangiomas. These are probably the most recognizable ones. They're right on the skin surface, often look like a bright red strawberry, sometimes a bit raised. People often call them strawberry marks.
Ah, the strawberry mark. Okay, I've definitely heard that term.
Yeah.
Makes sense. Bright red on the surface.
Precisely. Then there are deep hemangiomas. Now, these are different because they occur under the skin. So they might not be that vibrant red color. They could look more like a bluish lump or maybe just some swelling. Sometimes they have a slightly rubbery feel to them.
Oh, interesting. So under the skin, maybe bluish. That could look quite different.
It really can, and that's why knowing about them is important because you might not immediately think hemangioma. And finally, there are mixed hemangiomas, and, well, as the name suggests, these are basically a combination of both. You might see a red, superficial part on the surface, but there's also a deeper, maybe bluish component underneath.
A mix of both. Okay. So knowing the type helps guide what observation, next steps.
Exactly. It helps guide observation and informs the conversation you'll have with your pediatrician about potential next steps, if any are needed.
That's really helpful for identification. Okay, now the big question for so many parents, why? Why do these appear? What actually causes them?
Yeah, that's the million-dollar question, isn't it? And here's where it gets really interesting, because the exact cause of hemangiomas, it's actually unknown.
Really? Unknown?
Still unknown. Which is important for parents to hear, I think. It's not something they did or didn't do. However, our sources, like the info from Omega Pediatrics, highlight several factors that seem to make them more common.
Okay, so not a direct cause, but risk factors maybe.
Kind of, yeah. Factors associated with a higher chance. For instance, they are seen more often in premature babies, specifically babies born before, say, 37 weeks.
Premature babies. Okay.
Also, babies with a low birth weight, so usually defined as less than about 5.5 pounds. They seem to have a higher incidence, too.
Low birth weight often goes with prematurity, right?
It often does, yeah. There seems to be a connection there, possibly related to how blood vessels are developing in those very early stages. And interestingly, there's also a suspected genetic component. If there's a family history, like a parent or sibling had one, the baby might be slightly more likely to have one, too.
A genetic link, too. So prematurity, low birth weight, family history, but no single known cause.
That's the current understanding. It tells us it's complex, likely involving multiple factors related to blood vessel development early on, but definitely not something a parent caused.
That's really good context and probably reassuring for a lot of parents listening. So, okay, let's say a hemangioma has appeared. What happens then? When should parents be concerned, and what are the typical approaches?
Right, this is crucial. And the good news, overwhelmingly, is that most hemangiomas are harmless. They don't cause any problems, and they'll actually resolve on their own over time. So very often, the main approach is just observation.
Observation. So just wait and see.
Well, it's a guided wait and see. Your pediatrician will monitor it during checkups. They'll watch its size, its location, how it changes. Most go through a growth phase, then plateau, then slowly start to shrink and fade. This is called involution. Many disappear completely by the time a child is 5, 7, maybe 10 years old, sometimes leaving very little trace.
Okay, so watchful waiting under medical guidance is common.
Right.
But what if it's bigger or in a tricky spot?
Exactly. Observation isn't always enough. For larger hemangiomas, or ones in sensitive areas like near the eye, nose, or mouth, medication might be used. The sources specifically mention beta blockers as a really common and effective treatment now.
Beta blockers, like heart medication.
The very same class, yes. It was discovered somewhat serendipitously that they work well for hemangiomas. They seem to help constrict the blood vessels in the hemangioma and signal it to stop growing and start shrinking. It can be given orally, like a syrup, or sometimes as a topical gel.
Fascinating. So medication can help speed up the shrinking or stop growth if it's causing a problem.
Precisely. Especially if it's interfering with function, like vision or breathing or feeding. And then in really quite rare and extreme cases, particularly if the hemangioma is causing significant functional problems, or maybe it ulcerates, meaning it breaks down and forms a sore, or if there's a significant cosmetic issue remaining after it should have faded, surgery might be considered.
Surgery as a last resort, then.
Generally, yes. For those specific, more complicated situations where medication isn't enough or isn't appropriate, it really underscores why having a pediatrician or a specialist, like a pediatric dermatologist, involved is so important. They assess the specific situation.
Right. Okay, so putting this all together for parents listening, we've kind of demystified hemangiomas, right? From what they are, that extra growth of blood vessels, to the different types you might see, like the superficial strawberry ones or the deeper bluish ones, or a mix. We've talked about the why, or rather the lack of a single known why, which is reassuring.
Yeah.
But also the factors linked to them, like being premature or having a family history.
Exactly. Removing that parental guilt factor is huge.
Definitely. And we covered the typical paths, most often, just careful observation, but sometimes medication like beta blockers, and rarely surgery if needed.
That's a great summary.
So the key takeaway here seems to be, while they're common, understanding and monitoring are key. And expert advice is readily available. You don't need to worry alone. And if you are looking for more in-depth info, maybe specific to your child, or you just want expert guidance, we highly recommend you visit omegapediatrics.com. They have a ton of resources on children's health topics, including hemangiomas, and it's a great place to book an appointment for that personalized advice.
Absolutely. Getting tailored advice for your child's specific situation is always the best approach.
For sure. So again, that's omegapediatrics.com. And hey, if you found this conversation helpful today, please do us a quick favor, like this video, subscribe to our channel so you don't miss future episodes, and please share it with other parents who might find this information useful too.
Yeah, sharing the knowledge helps everyone feel more confident.
Definitely. Okay, before we wrap up, here's a little something to think about. Given that the exact cause of hemangiomas is still, unknown, what other common childhood things, maybe things we just accept as normal, might we understand completely differently in the future, thanks to more research? Makes you wonder, right?
It really does. A wonderful point to ponder. Our understanding of child health is constantly evolving. Staying curious and informed is so important.
Absolutely. Well, thank you so much for joining us on Have More Babies today. We really hope this chat has given you some confidence and clarity about hemangiomas. We'll catch you next time.